Let us find answers to some commonly asked questions from Dr. Prerna Mittal, who is the new favorite plastic surgeon amongst all the females in our region. Hello ma'am, how are you doing today?
Hi, I'm good, thank you.
Let us get started with our questions.
Yes.
So, what is a breast reduction surgery?
Breast reduction surgery means to improve the shape and size of the breast to make it proportionate to the rest of the body. In some females, the breasts are larger than their body frame. So they have few problems like they have backaches, frequent skin infections in the folds. They are low on the confidence, they have social issues, they cannot fit into their favorite dress, etc. So we have to reduce the size of the breast, improve the shape and the symmetry so that it's proportionate to the rest of the body.
Okay, and who is a good candidate for the same?
As I said, ladies who have very large breasts as compared to the body structure, and people who have backaches because of the size of the breast, and they have frequent skin infections in the folds, and they just feel uncomfortable. They are like, they have social issues, they don't like going out or mixing up because of the size of the breast, then we suggest to have the surgery.
Okay, and what are the benefits of the surgery?
Immediate benefits are the patient has an active lifestyle, a more confident lifestyle. The backaches that she had, if she had before, gets resolved. The skin infections don't happen, and she can fit into her favorite dress. And overall, the people are high in their energy levels after the surgery.
Right. Are there any side effects of the surgery?
Certain complications that can happen are the scar problems. That is, the scar can hypertrophy. It can become swollen and bigger than the actual size, and it can also dehisce at certain points. That is, it can open up at certain points where tension is more. So that can cause. That depends on your healing too, on body's internal healing power and your genetic programming. And secondly, the dead spaces, the pockets of dead space that are created after the removal of breast tissue, that can get filled up with fluid or blood sometimes, which is known as seroma or hematoma. And thirdly, people may find asymmetry. For that, we do pre-op counseling as well, that some form of asymmetry is expected and it's natural too.
Alright. What is the surgery time and how much time does it take to recover?
The surgery time varies somewhere between 2.5 to 3.5 hours. The recovery is usually between 5 to 7 days. The patient can join back work after a week or so. We suggest a garment, which is a special surgical garment we suggest to wear for 4 weeks to maintain the shape and give support to the breasts. And we never advise bed rest. Immediately on the same day, we tell the patient to move about, do his routine basic tasks.
Okay ma'am, I was just wondering, will it be lifelong?
See, the breast tissue that we remove, it doesn't come back, the glandular tissue. But if a patient gets pregnant after this surgery, then the existing glandular tissue can hypertrophy, because of which the size of the breast can increase again. Or secondly, if the patient gains a lot of weight, then fat can accumulate. So again, she can have increase in size of the breast.
Right ma'am, that was very insightful. Thank you so much.
Okay.